All right, so we're back with a another tools of the trade and how we do or what it
What it
looks
looks
like
like.
combo. And Evie here is currently a back catcher, and I can empathize as I was one too for a long time. And the knees get banged up or they get tight or they get compressed because you're always in that low squat position, different types of angles, W sits, whatever,
Yeah.
blocking balls. So she kind of requested this one. So what I'm going to call this is the catcher's knee protocol. Let's just call it.
Catcher's knee
Yep.
pro.
All right. So she's going to be probably tight around the quads, tight around the hamstrings, but also like this calf area. It probably gets a little jangled up because you're in that extreme bendy sort of knee position.
Definitely. Yeah.
So I'm going to do, and I also power lifted. So the old, almost like the old school powerlifting knee wrap, but we're going to leave an open knee on this one. So I'm going to compress the top of that calf area, kind
Why
of
the
coming in
open
the
knee
tib,
though?
so you can bend it.
Bend it more. Okay.
Right. If this was a whole thing, you would be able not bend your knee, and
Right.
that's for that's purpose of squatting a heavy weight. So here we want to bend it because we want to get a little bit of movement in there, especially when she sits and she does the body tempering. So you can straighten out your knee still. Good. So she's going to flex her quad a little bit, and I'm just going to do a barrel wrap here with the Spud Inc. elephant wraps.
Elephant
Yep.
wraps.
And I'm going to go as high up on the quad as I can. And I am going to work my way back down. These things kind of seemingly go on forever.
Yeah, I was
And
about to
again, I'm going to
say.
keep the knee open.
Oh my god, how long am I going to be able to tolerate this?
Who
I can
knows?
already feel.
You asked for it, so you're going to do it. However long you can. I mean, typically under compression, you're looking at 3 to 5 minutes or until the limbs kind of go numb. However, whatever comes first. I know that's kind of a weird, scary way to do it, but we don't pull punches here. We get on the other side.
Yeah. Oh, I already am like.
Yeah, it's all right. You'll be fine. And you can do this just having it there and having your legs up. You can lay down, have your legs up, or in this case, we're actually going to roll the tempering rod on it. And again, I'm trying to get a decent amount of. I'm not going like. I think I'm pulling this maybe about 50 to 60% stretch. Nothing crazy. If you want to go heavier, you can.
Nothing crazy.
Yeah, nothing crazy. It's just you get a lot of wrap coverage with these because so
Yeah.
it feels more than what it is. But that's okay because you're gonna appreciate it.
After.
Yep, I
Later.
believe so. And really, I'm going to compress heavier the areas, the sensitive areas.
Ooh.
Usually in a catcher is going to be more toward the knee. So, and again, but I'm covering the back part of it a
How much
little
are
bit.
these now?
I have no idea.
No idea.
You'd have to look on Spud Inc.
I'm gonna look.
I think
that
I
up.
got them for like $40 when Spud was over at the seminar with Chico there and over at Donnie's
My right
compound, the
leg.
first compound
Ooh,
gym.
wow.
All right, so sit back more if you can, sit back more. So she's gonna have her knees bent, which is fine, and then we're gonna put the 50-pound rod. And she's just gonna roll her quads with it.
Not fall over.
Yep, not fall over. She'll be fine. What she can do, yeah, she can get as far. Now with the compression, what it allows you to do, if you have sensitive areas sometimes and you're just going body tempering rod on skin, sometimes it gets a little sensitive. With the compression wrap, I don't want to say it desensitizes it, but it gives you like a little buffer so you can really get into those sensitive areas, like right around the
Definitely.
kneecap. And she can put more pressure on there, grind it in, throttle it, whatever she honestly wants to do.
Yeah.
You can also do this with the hamstrings. Like if you've had someone that's pulled a hamstring, which I've had 2 occasions in my training where an athlete pulled a hamstring in training sprinting. And one of them was because he wanted an extra sprint to time a fly tendon,
I
and
remember you
pop it
telling me
went.
that. Yeah.
So we lost 2 weeks of training there, but we were able to get him back. And
Injuries happen,
Dante,
though.
you know who you are. You see this. Um,
Injuries happen though.
Injuries happen in training, especially when guys are getting pissing contests. But sometimes that's what happens.
And notice how you said guys.
Yeah,
Guys are ego.
girls don't ever get hamstring injuries. At least in my experience, for me anyway. But anyway, was able to get him back when I would compress the hamstrings and then would actually roll the hamstrings with this. And as harsh as it was, it's kind of like the Charlie, I think it was Charlie Francis who had that protocol of trying to realign the hamstring tissues, because when you actually pull a muscle, you think muscle fibers run parallel and they're nice and neat. Well, what happens is when you pull them, they get like spaghetti, and you got to find a way to realign them. So finding someone like a massage therapist to do it.
Yeah.
In our case, we didn't have a massage therapist. We had compression bands, steel, and my knowledge, and we were able to do that. But
Yeah.
How you feeling now, Evie?
I honestly, this feels good.
It was like a little creaky at first,
Yeah,
and
now
now
it's
it's kind
kind
of
of going
loosened
away,
up.
but my right one I could tell is already getting
Get a
there.
little off. Okay.
Yeah.
So we can take it off whenever you
The
want.
right one, yeah. I was gonna ask something, I forgot. What was I gonna say? Oh, do you ever do this like with movements? Like I've seen
You
compression.
can.
Like
Yeah, you
like
can.
what if I like wanted to do some squats or something
Yeah.
right now, or lunges?
Yeah, you can go ahead and do that right now if you
All
want.
right, let's see it. I want to see how it feels. That's why.
Yep.
I can even stand.
So it's going to be pretty tight, so she'll feel like, yeah, you'll be all right. You want to try it? Go for it. Yep, up and down. Yeah, your speed of movement may not be a lot, but I mean, if you look at this too, it's
See
kind of
some
along the
lunges.
lines of your occlusion or blood. They call it blood flow restriction
Yeah.
kind of deal. And really, it's just to kind of garner some movement there. So you can do whatever movement you want. Recovery protocols, we're not really doing this. Maybe a warm up type deal.
Yeah. Oh, cool. All right, I think this right one's good.
All right, let's take that guy off.
But yeah, this feels
And Evie can even
the right one.
work
Let's do
on
the
it.
right one
Yeah,
first.
go ahead.
Okay.
Take it off.
Oh, me?
Excuse
Bless
me.
you. Let's see.
Yep. Then it will go this one. We'll just
Oh,
unravel it. You can see there's going to be some markings or maybe some redness. That's usually because there's a little bit of stagnation there. Some people call it. It's just sometimes stuff that's got to get, you're compressing that area.
Cool.
Let's see how you feel now.
yeah, that feels a lot better.
It almost feels like the sensation you'll do if you do this after like a training session, whether it be hard or whatever. You might be a little sore.
Yeah, I did.
After you do this, many will report that they feel like they didn't do anything in training, which
feels
is
good.
a great feeling to have, because you're not sore anymore.
Yeah, I did a pretty tough training session this morning, so I do feel a lot like more refreshed. But I still got practice later, so.
Yeah. So anyway, so when you're an athlete, you got multiple stuff you got to do in a day. You got to think about, for every maybe 1.5 to 2 training sessions, and that could be gym stuff, sprint stuff, on the field, on the court, in the pool, whatever it is.
Whatever, yeah.
Counter it with one recovery modality. With the stuff we do here is obviously in the field, it's in the gym. You can go see your physical therapist or your massage therapist, but if you don't have one available or you can't get there that often, have stuff available in your gym. That's why, over the years I've invested in this sort of stuff. So,
Or
my
even like
clients and
we've
my
shown some
athletes.
different ways to like
Yeah.
body temper with the kettlebell.
Yeah.
So yeah, you could do that.
There's stuff available, guys. You just got to be inventive or
Creative.
feel free to ask us questions as well.
Yeah.
Do it.
All right, nice job. Recover hard always.
After you work hard always.